Hello everyone, you're watching TV Asia. I'm your host Aditi Lamba, bringing you the best of South Asian representation and voice from North America and India. This is another episode of Face to Face. Today it's an honor and privilege to have pioneers of stem cell therapy all the way from India in Vadodara. We have with us today on the show Dr. Pravin Patel and Dr. Sunita Patel. They have an anti-aging clinic in India and they have dedicated themselves to serving the underprivileged communities, coming up with a lot of medical innovation. Thank you so much for being with us today on Face to Face.
Thanks for inviting us.
Beautiful. Talking about your anti-aging clinic, it's very interesting. You are two pioneers in stem cell therapy in India, and other therapies have actually gone out of the conventional way and have tried to bring some different research and methods of treatments to help people with cancer, diabetes, and several other problems. Give us a little insight into this anti-aging clinic that you guys have established and how this journey has been so far.
Well, I was practicing medicine in USA, Los Angeles and Las Vegas. And then I realized that I should go to India and give the same service because I was doing the research on the stem cell here in USA. So I went there and started a very small clinic and started with the stem cell. We are getting a very good result of that. So slowly we are expanding. And we do diabetes type 1, type 2 with the stem cell, plus our own medicines which we have developed and years experience. And that works wonderfully with diet, with stem cell. And we use the stem cell for the knee joints, we use it for the lumbars, cervicals. And we have other therapies like ozone therapy, vitamins therapy, which we use for the diabetes and some other diseases, We do the vitamins therapies, ozone therapies for cancer also. Works wonderfully.
So you were in Los Angeles. You both were in Los Angeles and Las Vegas for over 30 years, right?
Correct.
And then one fine day, you both decided to pack your bags and go back to India. Dr. Sunita Patel, give me a little background into how the whole decision came together as.
Actually, after going back to India, his main intention was to serve the people of India, share his knowledge. So we started a small clinic in India, and it started with stem cells and different alternative therapies. Initially, we were small, but as people started getting good results, we started growing. And we kept on updating our knowledge and bringing new alternative methods of treatment, like as he told you, quantum therapy, chelation therapy, vitamin therapy, ozone therapy, laser therapy, bioidentical hormones therapy, and that's how we started growing. Today we have patients coming from all over the world. And our success rate is more than 85 to 90%. So all the patients are very happy, and that's how we are growing.
How did this whole concept of trying to come up with these therapies or these innovation methods come about? Because this is one really controversial when you think about it. Living even in the US or in India, stem cells have always been a huge topic of controversies and conversations. How do two physicians living in the United States travel to India, and instead of opening the regular clinics that a lot of doctors actually do that in India, you go ahead and start something completely different?
When I was practicing here, like any other physicians, I also used to write the prescriptions. And for a while the patient would be okay, but then again some side effects or something was happening. So that was bothering me, that there has to be something differently should be treated. So I started the research on stem cell and other things. And that made me to realize that it's not only medicine is going to work, it has to the whole body, entire mind, body and soul treatment has to be done. So I was looking into that. Then I came to know that the cell and the hormones are two most important parts of the body. And if you don't do the cell therapy, then what we are treating is just only symptoms. So if you make the cells healthy, then the person is going to be healthy. So that's why I come to the stem cell. And stem cell, the only master cell which can be converted into the cell requires according to the disease. And that's the way we started the stem cell.
Doctor, for all our viewers of TV Asia, could you just give a little background knowledge on exactly what stem cell is and how that works to help cure all these problems?
Would you like to?
Yeah, basically stem cells are master cells of your body. They have the ability to repair any damage in the body. They have ability to regenerate the cells in the body, right? That's how
Right.
they basically work. So once they are, the cells are injected in your body locally or wherever they are required, they start repairing the particular organ which is damaged, and they start regenerating new cells in that particular area, let's say
Right.
liver or kidneys or pancreas. Once that particular organ is regenerated, there are new cells,
Right.
and which is repaired, it starts working or functioning like before, like a healthy organ.
Right.
Once your body is healthy, the capacity of your body to heal itself increases.
Right.
And in fact, with stem cells, automatically the body heals itself.
And how is it transferred into the body?
They are, if it's an internal problem, let's say liver or kidneys or pancreas,
Right.
we give it through intravenous. Okay, intravenously they are administered.
Right.
And if it's a joint problem,
Right.
we locally inject the stem cells in the problematic area. Once they are injected, they start doing their job. And within 3 to 6 months, you get excellent results.
Right. And you said in our earlier conversation right before this interview, you were saying how there is absolutely no surgery involved in any of these stem cell therapy or quantum theories that you guys are doing.
True.
Yes.
There is absolutely no invasive surgery is required. Definitely not.
Apart from just the injections,
Right.
injecting the stem cell, because both of us always worked for that. He always wanted to avoid surgery, to avoid any chemicals and avoid any side effects, and I'm sure all our viewers will also like that, because all of us know the limitations of conventional medicine.
Right.
Of course, when there has to be an operation or a surgery, it has to be done. But there are ways in which you can avoid surgery, and that's what we both were working for.
Beautiful. More on their methods and all the innovation techniques that have come through the anti-aging clinic. Stay with us on Face to Face. We'll be right back. Welcome back. You are tuned into Face to Face, and I am Aditi Lamba. We're currently in conversation with Dr. Pravin Patel and Dr. Sunita Patel. So right before going on the break, we were talking about the stem cell therapy that you have been working on for over the last few years, especially in India, in helping the larger community as well as the underprivileged, and how this whole innovation and this new method of treatment has helped you get a lot of successful results. In that aspect, when we're talking about your anti-aging clinic and going into this unconventional area of medicine, give me a little insight into what have been the challenges thus far, and do you see it getting better with years?
Challenge is that whenever you start something new,
Right.
there is always people are going to oppose. My colleagues, my other physicians, they would oppose also because they haven't heard these things or they don't know much about that.
Right.
So yes, initially there was lots of oppositions, but now slowly when the patient talk to their doctors and we talk to the other doctors, we explain how it works. So it's accepting now. There is a controversial opinion whether it works or not because it's not FDA approved yet.
Right.
So it's an experiment, known as experiment, but still the results are, when the results are coming, people do believe and people going more and more in that.
So when someone approaches to you saying that this is not FDA approved right now and it's still under clinical research, what is your response to them at that point?
We explain that anything comes new takes several years before it becomes approved by
Right.
FDA. So right now it is experiment and they have choice to go through or they have choice not to go through. We are very open to them.
How has the response been in India so far? I know over here in the United States, as we were talking before, there's much more acceptance, and as you said, there's more growth of a faster research method. When you go to India, to a country where they already have so many issues with just normal conventional medicine, how has the response been to this unconventional method?
See, initially people were opposing it because the basic reason is there's no awareness of stem cells.
Right.
But we have been creating awareness. We have been writing some articles in the newspaper and some, television where people were getting more information about stem cells. In fact, even certain doctors in India have no awareness about stem cells.
Right.
So we have been doing that work since many years, creating awareness about stem cells, and it has worked. It has helped a lot of them, and people are more open now.
Right.
That's why people from all over the world, as well as all corners of India, they are coming to us for stem cell therapy.
Give me a little procedure information on how this whole program works. I know you help the underprivileged community, and I know that's done free of cost through your funds. But for someone who's able to afford it, give me a little insight into how that whole procedure works.
You mean how the procedure starts?
Yes.
Well, it depends again on the disease, but if you have to do the stem cell procedure, there are a few tests required, almost 6-7 tests required. There should not be any infection into the body, because if the cells are infected,
right,
and we transplant the stem cell, then the stem cell also will get infected. So there are certain tests has to be done. The first step is the test has to be done. 6-7 tests are there.
Right.
Once the tests are clear and there is no infection, then we decide which procedure we are going to do. It depends again. If it's diabetes, simple things. We give 2 injections.
2 injections.
And third day we extract the around 50 cc blood, and we separate the cell from that. We send it to the stem cell lab. Right. They culture, they differentiate, they send it back to in 10-15 days. Once we get it, we just infuse through the IV.
Right.
And that's it.
And what about the costs behind all of this?
Cost varies. Again, what condition it is, what degree it is.
And the weight of the patient.
And the weight of the patient. So many things we have to take into consideration.
Right.
But if I talk in rupees, then I would say somewhere like 2.5 lakh rupees to 3 lakh rupees. And if you're talking the dollars, around $5,000.
Wow, that's quite a decent amount of money right there.
Yes.
So when you're talking about that much amount of money which is required for a stem cell therapy or something that's in that innovation industry, how does this whole program run, especially when you look at the underprivileged community who are being right now treated by you free of cost?
For them, what we do is all the expenses are borne by us. Actually, we have a trust known as the Hiba Trust, which is Hiba is his mother's name. So through the trust, we help these people who are underprivileged for health as well as the medical issues. And this is without any donations. Of course, if there are donations, that will help us more to take care of these people.
Right, but this is solely being run by you both right now.
Both
Yes.
of us.
And what about the government, influence or any other charitable costs?
We are not getting any help from the government.
So if someone was to help you or to donate you, how can they go about that?
They have to contact us and then contact the trustee she's the trustee.
I'm the trustee. They'll need to get in touch with me. And they can help us and to help the other people.
Give me a little detail about your team that's in India right now that works in the anti-aging clinic, and how have you gathered everyone together, being someone who moved from LA all the way to India?
We have a team of nurses. Initially, they had this training in conventional medicine.
Right.
So it took us, it was a hard time because I had to teach them all our therapies. So we had to, let's say, train them for about 6 months to understand each and every therapy and the procedure.
Right.
Today I have about 5 nurses who are very well trained in our stem cells as well as the alternative methods, and they take very good care of our patients.
For someone who was a physician in the United States, how has being a physician been and helping these patients been in India for you?
Well, there are two sides of the moving to India. When a elderly patient suffered a lot, tried everything else, and not recover from the disease, and when we are able to do either stem cell or ozone or vitamins or the chelation, what are the therapies you're using, and the blessing what we get it, that makes me to stay in India. Sometimes I miss America because I lived so many years. The quality of life is a lot better here.
Right.
But when you are able to help the people,
Right.
there is no better fees or better joy than that.
It's
You
gratifying.
get
It's
the blessings
gratifying.
of the patients. you know.
Blessing. And we do several times. The patient bow down to us. We say no, don't do that, but still they do.
Right.
What I want to say is, when we see the happiness on the face of the patient who was under so much depression, who was under so much pain, and they come back and tell us that we are recovered, we are very happy, and they give their blessings, that is the real gratification for us. We feel really happy with that.
More on their benevolent effort and all the gratification and the success stories coming right after the short break. You don't want to miss this face to face. Welcome again. You are tuned into Face to Face, and we're in conversation with two pioneers of stem cell therapy in India, Dr. Pravin Patel and Dr. Sunita Patel. Right before the break, we reflected deeply upon the anti-aging clinic and all the treatments that are being offered from there, be it stem cell therapy or being all the other innovations that you have given. But right now I'd like to talk a little bit more about you, because you have had a great line of successes, especially in India, and you've been recognized on many global platforms. Especially the one that stood out to me was the Grahak Suraksha Award, which is the Consumers Protection Award, which was awarded to you by Mother Teresa.
True.
So how was that experience, and give a little insight about that to our viewers.
Well, we were making lots of medicines, and my company was the first company who gave the money back guarantee in India, that if you don't get the result, we will refund the money. And that's why that was the protection of the consumers, basically, because the consumers buy medicines and it doesn't get the result, then his money is lost. And we
Right.
make it sure that nobody loses the money, but they get the good health. And that's what we proved that, and that's why we were awarded for the Grahak Suraksha Award by Mother Teresa.
How did that moment feel for you? You know, Mother
That
Teresa
was the
is known.
most glorious moment of my life. And I thought she might have forgotten,
Right.
but no, she remembered me, because I received the email from one of the Colombian ambassador from USA, that Mother Teresa mentioned to him that when he gets tired with the Western medicine, he should contact Dr. Patel.
Oh, wow.
And I received the email. So for so many years he remembered me, and that joy is non-describable, undescribable.
And Dr. Sunita Patel, you've been with him through this whole journey of struggles, of getting successes. How has it been working with him, and how has that whole journey treated you?
Well, it was really enjoyable. Even when we were under stress, I got to learn so much for him. He is my guru, I can say, because he's the one who taught me. And it was wonderful being with him, because at every step he taught me, and he's such a positive person that even in adversity,
Right.
he used to tell me, he used to show me the light at the end of the tunnel, and we kept working hard, and I kept learning new things from him, and he encouraged me to go and learn new therapies,
Right.
learn new kinds of treatments, and I'm really truly blessed that he is my husband, and he's really changed my life for better.
This is definitely a story of two partners of life and two partners at work doing some big benevolent service to the community. How does that whole combination work for you both?
It's just the life is so beautiful, let's put it in one word.
Right.
When we are working together, when we are able to help the people, though there is no better service than that.
And we are both totally devoted to our patients. We do not have children, so we have all the time we have, we spend it for our patients.
So your patients are your
devoted for the
children.
patient. Yes,
Correct,
exactly.
correct. They are
You
our
said it.
family.
Give me a little bit more about this family. I know you have a lot of success stories, but I really want our viewers to learn about some of the main ones that you've helped.
Well, you want to know the patients, about
Yes,
the patients?
about the patients. Some of the
Um,
testimonials that you like to share with us.
I give you one small example. We met a patient in London last June. I would not mention the name, but she has a problem since many, many, many years. And she was totally depressed. So many problems were there. And she talked to us, and we said that you come to India, we'll take care of. She came in November.
November.
We treated for 2.5 months. She did not know Gujarati. She spoke only English because she was born and brought up in London.
Right.
So she had some hard time because she couldn't speak any other language than English. But at the end of the day, what she said, that her life is totally changed. Her husband said the same thing. She looks totally different. All the issues, depressions, imbalance, coccyx,
The pain.
the pain, thyroid, everything has improved, significantly improved. And when she went back to the London, her doctors were surprised, and they hugged her, seeing the result. So
Right.
that gives us a pleasure to do something like that. Another lady from San Francisco, she had a knee problem and the diabetes.
Right.
They
Couldn't
stayed,
sleep.
she couldn't sleep because of the pain. We did a stem cell for her, and we did some ozone therapies and like that.
Right.
And within a month, month and a half, everything was changed. And she said she could sleep like a baby now, without any pain. So this kind of the patients we do treat.
Right, and you've also claimed that you have been successful in curing type 1 diabetes, which has not been cured on a conventional side.
I would say we are successful in type 1, but 30-40%, not like type 2. Type 2, I would say I'm successful 80 to 90%.
Right.
Type 1 is not easy, but out of 6-7 cases, we are able to do 2 cases like that.
What about cancer research and liver
Yes.
diseases and all the other issues?
Cancer, we are very successful. It needs lots of discipline by the patients, diet, and the lifestyle that has to be changed. So we are able to help the cancer patients through the non-conventional medicines. We use the vitamins, we use the ozones. Likewise,
Without chemotherapy.
without no chemotherapy.
No chemotherapy for
No
cancer
chemo-
patients.
No, we don't do that.
When you are doing all this research yourself and still learning, as you say, at your age and at the level of prominence that you've achieved, what do you have to say about the future of this industry? Do you think stem cell therapy is going to be very, very big in the next few years?
Stem
Absolutely.
cell will be the medicine of the
Of the
future.
future.
It's a regenerative medicine, and as everybody has a degeneration in their body. When we are able to regenerate something with the stem cell or any other therapies, that's the medicine of future, including the ozone. Ozone is also going to be
The
medicine of future.
Do you have anything to say?
Yeah, and then with that you'll be able to cut down the surgeries, the minimum use of surgeries. And people are, I'm sure, most of the people are scared of surgeries. They
Right.
do not want to go for surgeries and chemicals which have side effects.
Right.
So that's the reason why this will be the future of medicine.
And right before we let you go from this really informative and very interesting interview, is there advice that you like to give to all the medical students or other health professionals that are in the field and they might be looking for other techniques or treatments in helping all these diseases, as well as what's something that you like to tell all our viewers?
Well, what I would like to say to all the new medical students is that they need to keep their mind open. Please keep your mind open. Not only conventional medicine, but there are a lot of alternative methods of treatment which can benefit your patients without any side effects. I'm
Right.
sure in conventional therapy people know about the side effects, about the risk involved in surgeries. So the young generation should be open to new alternative methods of treatment. Go and learn them, and I'm sure you'll be able to benefit your patients better. That's what I believe in. You know.
Suggest to my viewers to check our website www.drpatelsantiagingclinic.com. Also, our videos are on YouTube also, and you will be able to see many videos on the website also.
I can't thank you both enough for being on the show with us today. And I wish you all the very best for all the treatments and how you're helping the bigger community. Thank you so much, and it was a privilege to have you over here. Thank you for tuning in to this week's Face to Face. I am Aditi Lamba signing off.